All right, welcome to Deuk Spine Institute. We're just working with one of our patients who's having both back and any way you can get that L5 better. He's having pain in his lower back from the disc at L5-S1, but also from the facet joint at L5-S1. And we're going to fix both today. Shot? We're going to fix the facet pain as well as the disc pain. Shot? That should be it right there. Shot? 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 All right. The first thing we're doing is we're treating his facet joints. We've already placed the needle into his disc to do his Deuk laser disc repair. Shot? However, we're not doing that yet because we need him to be a little bit more awake. Shot? I'm targeting a spot right on his sacrum where the pain nerve runs. It's pretty close to where I'm at right now. Shot? Shot? Yeah. We're just lateral to the facet at 5-1. Go ahead. Is he all right?
Still sleepy? Very sensitive.
Well, I don't think he takes much in the way of medications. Yeah. So it's not surprising. He's very sensitive. Shot? All right. Shot? That's nice. That's a nice place. All right, that should be it for the facets. Next will be his disc. Let me know when he's awake. So, Henry, would you run the video explaining to our audience why do discs cause pain when they're injured?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, well now you understand why a herniated disc causes so much pain. It's actually inflammation. Has nothing to do with the nerve roots. It has to do with inflammation going on in a tear in the back of the disc. Deuk Spine Institute is the first place in the world to discover this and of course to treat it. We call it an annular debridement, and it's part of the Deuk laser disc repair. Now this patient has had horrible back pain here in his back. We just treated his facet joint at L5-S1 with the Deuk plasma rhizotomy. You can see the incision right here. It's 3 millimeters. And we're getting ready to treat his L5-S1 disc, which is also damaged, causing pain. And we're just waiting for him to wake up enough we can do a discogram. All right? Any questions? Let's go ahead and look. We did a little bit of a discogram just to make sure we're in the right place. Within the disc, you could see on the x-ray, Henry, go to the x-ray there. You can see the white arrow is showing you the annular tear. It's huge. Big old tear at L5-S1. So, all right. Let's take the questions.
First question comes from Canes25 on YouTube. And they asked, Doc, are older thoracic herniations usually calcified?
So are older thoracic herniations usually calcified? The answer is no. I've seen 80-year-olds with soft thoracic herniations. Most thoracic herniations are not calcified. 95% of them are not calcified, the ones that are symptomatic. Very rarely do you see a calcified thoracic disc herniation. It's not common. And it can be misdiagnosed. The only way to diagnose a calcified thoracic disc herniation is with a CAT scan, CT scan. And you'll see literally a solid, big, thick, herniated, calcified disc, just solid bone. And it's extremely rare, like I said. Thank God most of them are not calcified. All right, how's he doing? Are you having any pain?
You having any pain anywhere? Where's your pain?
Probably from the rhizotomy.
Pain over his lower back.
It's from the rhizotomy, I'm sure.
Any pain down your leg, sir? My friend, any pain down your leg? No? No pain down his leg.
How bad is that on a scale of 1 to 10?
0 to 10. What? 9.
9. Is that where you get your pain? 9 over 10, discogram. L5-S1. All right, you get to put him back to sleep.
We're going to go nice and slowly.
We just tested him, and he's got 9 over 10 pain at L5-S1. We call it concordant pain because that's where he typically gets his back pain. We've already completed the rhizotomy of the facet joint because he was having both procedures done. I could tell on the exam, based on where his pain was, that it wasn't just the disc causing pain, it was also the facet joint. So that's why we treated both. And we've already done the rhizotomy with the Deuk plasma rhizotomy, and now we're getting ready to do the Deuk laser disc repair. All right, what other questions do you have, Henry? Num num?
Next question comes from Tino on YouTube.
Yes, Tina.
They ask, how do you determine when it's disc pain, facet pain, or both?
Tino, that is a great question. All right, so disc pain is virtually always in the middle of your back, okay? It's central and paracentral, meaning it's here and maybe slightly off to the side. Facet pain is more to the side, and facet pain is worse with extension. So you have the patient extend their back or twist their back to see if you can set it off. That's facet. And then most importantly, I push on the facets. And if they're tender, like imagine pushing on a knee that's tender, right? Swollen knee with arthritis. If you do that and the knee starts hurting, well, you know that's arthritis in the knee. So basically pressure on the joint and tenderness, basically what we call tenderness of the joint, that would be very diagnostic. So it's location, it's tenderness, and it's exacerbating movements, mechanical movements. And then the last thing you do, if you want to know for sure, is you do what's called a medial branch block, where we numb up the joint with Novocaine and see if it takes the patient's pain away. Because you're only going to take away facet pain if you numb up the facet joint and it takes the pain away, it's got to be facet joint pain, right? So it's like if you have a tooth that's hurting in your mouth and the dentist numbs up the right tooth, the proper one, they'll take the pain away. We do the same thing with the facets. Okay, if you numb the wrong one, then it's not going to take, sorry Luis, it's not going to take the pain away. Oh my gosh, Luis is going to kill me. I'm sorry. I could blame you and say you moved, but unfortunately it's all on film. It's all on film and you could see that you did not move. So it's all my fault. Good questions.
We have another question.
Uh-huh.
This comes from Canes25 once more. And they asked, what makes a disc calcify?
Shot. What makes a disc calcify? Nobody knows. Nobody knows. Well, first of all, the disc has to be damaged to calcify. So it's something to do with being injured. But not all damaged discs calcify. Most of them do not. But they do get some calcium, but small flecks of calcium called dystrophic calcification. But to make a disc completely calcify is unusual, very rare. And nobody knows why. I don't know why. All right. I don't think anyone knows why discs will calcify. It may be a molecular biology thing, like a genetic thing. You know, something about the genes. There may be some kind of a gene in that patient's DNA that somehow promotes calcium. Like, I don't know. I mean, all these discs are inflamed, but you don't see them calcify solid. Like a solid calcium is something else. We see that with something like some kind of tumors, like certain kind of meningiomas will calcify. I mean, there are calcified lesions in the body. I just don't know why they calcify. I don't know that anybody knows. I think we're going to find it's a genetic thing. Something to do with that patient has genes that promote calcification of things that are abnormal. But discs rarely just calcify on their own. For example, with ankylosing spondylitis, you'll see calcification of the spine. So autofusion, the spine is fusing itself. But I'm sure there's other types of conditions that are similar to ankylosing spondylitis, where calcification can occur of the discs. But it's not a common thing, thank God. All right, I can't get that guy out where I'm at. I'm gonna have to pull back just a little bit. So we're at the L5-S1 on the right side. You can see this is an abnormal disc. The blue dye is staining abnormal tissue, specifically herniation of the nucleus that I've kind of shoved back into the disc when I went in with the dilator. That's part of the treatment, is to reduce the herniation back into the disc and then remove it endoscopically from the disc. It's safer to do it that way. You don't jeopardize the nerve roots. Great questions.
We have a few more questions. This next one comes from Matt on YouTube.
Hi, Matt.
They asked, what is the difference between the DLDR and a traditional microdiscectomy?
Oh my God. Too many things, too many differences. Matt, too many differences to name them all.
We have a video of comparison.
I have a video on YouTube that shows what a microdiscectomy does. First of all, the microdiscectomy is a much bigger incision. It's literally 3 to 4 times bigger. Then the microdiscectomy destroys your muscles in your back. The surgeon literally cuts through them, peels them off your spine. Deuk laser disc repair does not destroy or damage the muscles at all. Microdiscectomy then cuts a hole in your lamina or bone in the back of your spine. Deuk laser disc repair goes around the spine. It doesn't cut any holes. That laminectomy, by the way, is very bad for you. It's going to weaken your spine. Microdiscectomy then goes and cuts out half of your facet joint, which is needed to stabilize your spine. Deuk laser disc repair does not remove any bones, any ligaments. Then microdiscectomy removes your ligamentum flavum. Takes the ligaments out of your spine that are put there to stabilize your spine. Deuk laser disc repair does not. Microdiscectomy doesn't work very well at all. Sometimes you can get the herniation when it's really big, but a lot of times it doesn't work at all. Deuk laser disc repair, I've not seen it not work. If it didn't work, there would be a first. Now, it doesn't mean it cures everybody's pain all the time, because if you have pain coming from the facet joint, then we're not operating on the facet joint. Well, we're not going to cure that pain. So you have to treat all the sources of pain to cure the pain. Microdiscectomy doesn't cure any back pain at all. It's not done for back pain. If you ask your surgeon, hey, will this microdiscectomy take away my back pain? Their answer is going to be no, it won't. Microdiscectomy doesn't take away back pain. So then microdiscectomy causes instability after surgery. Deuk laser disc repair does not. I think those are the main differences. Microdiscectomies lead to fusions. Deuk laser disc repair does not lead to fusions. Microdiscectomy is a destructive surgery. Deuk laser disc repair, we're not destroying anything. The only thing we're doing is cutting your skin.
We have another question.
Microdiscectomy, you need to take narcotic painkillers after surgery because it hurts so bad having the surgery. And the reason it hurts is the surgeon is literally destroying your spine to do the surgery and your muscles. Deuk laser disc repair, there's no narcotic painkillers given after surgery because we're not destroying anything. We're just cleaning a tear in the back of the disc and removing the herniation. So we're not removing or damaging your body to get to the herniated disc. Those are a few of the differences.
We have another question.
Sure, just ask. You don't have to tell me.
This
Just ask.
Next one comes from Teak on YouTube, and they ask, when you do your assessment, what is the biggest sign that a DPR is what needs to be done versus a DLDR?
Yeah, again, DPR works for facets. DLDR works for discs. DPR will not work for discs. DLDR will not work for facets. Two totally different sources of pain. Now, on the exam, I can see usually where the pain's coming from on the physical exam. So I have to touch the patient's back. And that's why some of these patients will come from far away. They'll get to my clinic, and then when I examine them, I realize, wait a second, they've got facet pain, because facet pain you really need to touch to know for sure. You need to touch, there's a piece of herniation. You need to touch the patient's back and press on things. Same thing with sacroiliac joint. The SI joint is like a giant facet joint. It's actually the next facet joint below L5-S1. If you think about it, the L5-S1 facet joint, and then below that you have the sacroiliac joint. Same type of joint. They're called diarthrodial joints. Just about done, doctor. I need 1 minute and we're done. A lot of inflammatory tissue down here. And he does not like this, I could tell. 1 minute left. No. We're done. I mean, I just have to finish this. Just trying to get as much as I can get out. I want to do one more grab. See if I can get a little more. Any other questions?
No current questions.
Yeah. So we're just about done here. Just another minute and we'll be done. Let me see if I can do a little more. His facet joint is really blocking me. I think I can get a little more right there and then that's it. Remember, I'm trying to go medial. Medial means towards midline, towards where the spinal axis is. And I've cleaned out the herniation, it's gone. There's just a little bit left, and it's always a matter of how much are we going to leave. And of course, for me as a surgeon, I want to leave as little as I can. And what limits me is always the anatomy of the patient. Everybody's anatomy is a little different. All right, I feel good about that. Oh yeah, nice. Very nice, that should do it. You can see the L5-S1 disc space right there. I'm just looking lateral. I'll bet you we could see the S1 L5 nerve root. There it is right there. You guys see the nerve root right there? That's the dorsal root ganglion. So you see how we're just below it? That's the secret of the surgery. You want to be just below the nerve root. Some nerve roots, there's less fat around them. You can see them better like that one. And some nerve roots have more fat around them. You can't see them as well. But that was a perfect view of the nerve root. You can see we're not damaging it in any way. We're just below it. And that's what you always want to see. Now, of course, the mistake you'd make as a surgeon is to go through the nerve root, which would be very bad. But that's why we have our patients awake. They help to make sure that I don't go through the nerve root. And I use the X-ray machine, which is the top of the line machine in the world. We have a Siemens Flow, right? Which is number one, the best, has the best quality pictures, the best resolution. It's just the best. And we have 2 of them we just bought, so we could take better care of our patients. And you can see everything clearly, clear enough to make sure you don't have any complications. After all, the quality of your instruments and tools that you use in surgery will determine the effectiveness of your surgery as well as the complications. If you have poor quality tools and instruments, then you will have less effective surgery because you won't be in the right spot. You won't be able to tell that. And then, of course, you'll also have not just less effective, but higher complication rate. All right, I'm going to put a stitch. But we're pretty much done here. Go ahead and type up any of the other questions you have, and I can take them. Our next surgery will be a Deuk laser disc repair thoracic. This patient travels from Pennsylvania, and she has 3 herniated discs that are very small. They were missed by her radiologist, missed by her doctor. They told her she just has to live with the pain. She's in excruciating pain in her thoracic spine. And we're going to be fixing 3 thoracic discs in 1 surgery for her. And Henry, we can wrap up the broadcast if you want.
We have a couple questions.
All right, so just say them for me.
Copy
But
that.
go ahead and take us to a testimonial, and I'll be there shortly to answer them.
Copy that.
And I'm Dr. R. Deuk here at the Deuk Spine Institute. I'm smiling because I'm sitting with my first surgical patient of 2023. I don't know if you realize that, but you were the
Oh.
first one of this year,
Okay.
of the new year. Now, you had the Deuk laser disc repair done on your lower back because you had 3 bad discs. And we did that yesterday.
Yesterday, yes.
And here you are, one day later. How do you feel?
And I feel good. I feel good, and the pain that I've been suffering for months is gone. I mean, I was a little bit sore, but that's from the surgery itself.
Yeah.
But otherwise, I feel good. Feel good.
Now, you've had back pain too, on and off for 30 years. We were talking about that. Tell us about those episodes of back pain. What do they do to you?
The first one that I recall was pulling out a sofa bed thing. And I got so far with it, you know, we had company and I was opening up the bed, and all of a sudden I just could not move. I couldn't move. My husband had to practically carry me. So I was out of work for a week or so, and then at the chiropractor, and then gradually it got better, and I thought, well, that's fine. And I moved on. And then, you know, had a couple other times like that. One time I was drying my hair, getting ready for work with the blow dryer going like this with my hair, and all of a sudden it's like I couldn't move. I couldn't move my arm down. I couldn't, I mean, it was that quick.
Yeah.
And just, I was out again for another week, laying in the bed and doing all that stuff. And then I thought I was fine, but I always, not always, but for many years now, probably at least those 30, I had lower back pain, where in the morning I couldn't bend over to brush my teeth. You know, that would really hurt.
Yes.
So I had that.
Do you have that pain now?
No, I don't think so.
It's gone.
The pain this morning, I was the first time in a long time I've gotten up first thing in the morning and was able to walk and not have that awful pain, because first thing in the mornings was the toughest.
I'm so happy for you. So how is this surgery going to
I'm
help
happy.
you in your life?
Well, hopefully I can, once I can at least walk again. I was not able to barely walk with a walker. I was very active in my church and my
So you
community.
want to get active again?
And being in such pain now since July, and this is the new year, I'm anxious to get back to, you know, my life.
Yes, of course. Well, you had 3 herniated discs in your lower back, and you can see in the footage where we went into each of those 3 discs, and I used a laser to clean the tear, where you had a tear in the back of each of those discs called an annular tear, and the jelly from the center was stuck in the tear, holding it open, allowing more herniations to come out. So I got rid of the jelly that was in there using the laser, cleaned out the tear, and now your body will be able to heal that for the first time in 30 years. So I don't expect you to ever have that pain ever again.
Thank you.
You're welcome.
I am so thankful.
Well, you had faith,
I
and
am.
you found us.
Yes, I
and
did.
You did what's right for your body, and I'm excited for you. So
I believe I did. I just kind of was led to you, and it just all went bing, bang, boom, and I didn't ask a whole lot of other people what they thought. I just did what I thought was I needed to do
good.
for me.
Is there anything you want to say to your fans out there?
I would recommend that if you do something to your back, that you take care of it early on. You take care of it right away. The longer you wait, the harder it is and the longer it takes.
It takes a toll on your life.
Oh, definitely. It has taken a toll on mine since this summer, for sure, where I have not been able to, sometimes not function at all, barely be able to sit in a chair and be comfortable without squirming because I couldn't find that exact place where I didn't have pain. You know?
I don't see you squirming anymore.
No, I'm not squirming. I know. That's great. Sit here without pain.
Congratulations.
Thanks to you.
All right, have a blessed day.
Thank you. You do as well.
And good morning, I'm Dr. Deuk Machen. I'm here with one of my lovely patients from Canada who's visited us because her back has been hurting for 7 years. She's had a herniated disc that she's been kind of monitoring at L5-S1. And finally, it really started bothering her a lot over the last 7 months to a year, causing pain down into her right leg. So she decided to do something about it, and she went to see her doctor in Canada, who then said, yeah, I'll have you see the specialist in 3.5 years. Well, that wasn't going to work for you, right?
No.
Yeah, because you don't want to live in pain for 3.5 more years. And even then, you don't know what you're going to be offered. But she found the Deuk Spine Institute and learned about the Deuk laser disc repair, endoscopic surgery, and you had it done yesterday.
Yes, yeah.
How are you doing?
I'm feeling great today. I have no pain in my back. I have some tight muscles from me having to walk very oddly for quite a while due to the sciatic pain. I must say, this is the happiest I've been in a very long time to be able to stand up straight and go for a walk. Because I'm an active person as is. I ride horses for a living, so having to be locked up in my room for the past while has not been good. So this has felt amazing, amazing.
So you're happy with the results?
Very. I feel very hopeful also to be able to do what I want to for the rest of my life.
Yeah, after we let the disc heal, right?
Yes, full year of nothing, and then we can.
Yeah, I wouldn't say nothing, but you know, horseback riding, it's one of those things where I love horses and I love riding horses. I'm not very good at it, but I'm one of those people you see bouncing up and down, up in the saddle. So I know that it can be rough on your back, and I just want to make sure you give your back a full year to heal. So you can see in your surgery right here, we actually tested your L5-S1 disc with a discogram, which is a test done to verify that that disc is indeed causing your back pain. And when we tested it, you said, and we asked you how bad it was, you said 10 out of 10 pain. And I said, is that your typical pain you get every day? And you said, yes, it is. So we verified the source of your pain was the L5-S1, and you can see the laser was used to clean the tear endoscopically. Your incision was only a 1/4 inch, and there's no need for fusion or metal or artificial discs. This surgery replaces fusion and artificial discs. What are you going to do now that you're feeling better?
Well, it's, again, don't worry, I will take it easy, I promise. But no, I'm going to be, after this, this year, I hope to be the strongest I've ever been, and I have very high hopes and whatnot. My dream is to make actually the Canadian Olympic team for my sport, and that's end goal, and I feel like it's a possibility now.
Absolutely.
To do it.
You can.
Yeah.
We're rooting for you.
Mm-hmm.
And I know you have an incredibly supportive husband who's been by your side the whole time. He's a delightful young man, and I've had time to talk to him as well. So you're lucky you have support from your family to help you get through this.
Yeah.
Anything you want to say to your fans out there?
Oh, geez, I don't even know where to start other than just this place really can offer you really what either you deserve or what you need going forward to be able to live a happy and good life. And it's amazing to me that literally it was yesterday I woke up from it and I went for a short walk like immediately, and I felt amazing. So it's it's very hopeful, and if you are suffering from any of it, don't wait, especially for the Canadian system. Come and do this. It's worth it. It's really worth it.
Awesome. And I'm going to be, and my whole team is going to be watching the equestrian sports and the Olympics, looking to see for you to be there.
Yes.
All right.
Awesome.
And
Amazing.
of course, supporting you.
Thank you. Yeah.
All right. Congratulations.
Thank you.
All right. Take care. Okay, I hope you enjoyed that testimonial and hearing from one of our patients in the past who had Deuk laser disc repair done here at Deuk Spine. We've just finished up this patient, and I think he traveled from Texas, this one as well. We've had a couple from Texas today. And he has had lower back pain, and when I interviewed him, he was pointing right here, okay, off to the right side. And I looked at his MRI. He had a herniated disc at 5-1 that I thought was causing his pain, but he also had, when he came in, pain right over his facet joint. When I asked him to push on it, he was mashing on it and it was causing tenderness. So I said, you got two problems, my friend. Your disc is causing pain, also the facet joint. So you need to have both of them fixed. And some people ask me, what's the difference between a radiofrequency ablation and the Deuk plasma rhizotomy? A radiofrequency ablation, the target for the pain nerve is right here. You guys see this right there? Like right there, yep. Okay? Right where the transverse process, this little thing, meets the facet, right in that valley is our target. The problem with RFA, you can see the little red dot, is the doctor will stick a needle there, heat it up to 80 degrees Celsius for 60 seconds or 90 seconds, burning But that's all you get. They get that little spot right there. Well, what if the nerve isn't there? What if the nerve is off to the side a little bit? You can see these nerves run along the bones. Well, with the Deuk plasma rhizotomy, that's what we're doing. You guys see that red right there? That big patch of red? We get a much bigger burn area. That's because we hop and sweep. And we have a more powerful device to burn the nerve. So it's more effective. Long story short, that's what we treated. We treated the disc, which was I think it was a 9 out of 10 pain, or 8 out of 10, or 9 out of 10 pain for him. Plus, we fixed the facet joint, which was also very painful. So we did both during the surgery, and everything went well for him. So I'm very optimistic his pain will be gone. And hopefully we'll get a good testimonial from him tomorrow when we see him back. All right, any questions?
Yes. We currently have 4. This first one comes from Matt.
Matt?
On YouTube. Yep. And they asked, is it ever a concern while inserting the endoscope to hit a nerve, or while using the laser, is it ever a concern to hit a nerve?
Hey Matt, great question. So 2 questions. Are you ever worried about hitting a nerve when you're putting the endoscope in? Absolutely not. And number 2, are you worried about hitting a nerve with the laser? Absolutely not. And here's why. If you notice, the first thing I do at the beginning of surgery is I place a needle. That is when hitting the nerve could happen, just during that first step. Once I get the needle in and I'm in the disc inside the herniation, just so you understand what am I doing there. I have another model, but I don't see it. Anyway, I'm actually coming from, if this is the middle, I'm coming from the side, and I'm going through a hole that's naturally already there, right there. The herniation is right there, okay? So rather than coming through your spine and taking bones and ligaments and muscles out, we come around the side, right there, and we get straight into the herniation, okay? See that? Now, the nerve is exiting this hole right above the disc, right above it, right there. So as long as I get the needle in properly, and I stay low in the foramen, I keep the patient awake, I get their feedback, oh, it hurts down my leg. If I hear that, I gotta stop, back up, restart. That means that I'm too close to the nerve. So once I get that needle in perfect position, which I do right away, then the rest of the surgery, I'm not really worried about the nerve at all. If you don't do it this way, then you better worry about the nerve constantly, because you could be messing it up big time. Now, I learned this technique from Dr. Anthony Young. Somebody asked me earlier, did you know about Dr. Young and the YES technique? Absolutely. He was my greatest mentor in spine surgery.
Next question comes from Michael on YouTube. And they ask, can the Deuk spine repair, Deuk laser disc repair, be performed on old herniations that are 10 plus years, or just recent herniations?
Hey Michael, great question. Can the Deuk laser disc repair, what you just watched done, can it be done on old herniations that are really degenerated? Absolutely. It works equally well, 100%. It doesn't matter if your herniation is 1 day old or if it's 100 years old. It's the same problem. It's a tear in the back of the disc, whether the disc is freshly herniated and it's a nice annular tear that's inflamed, or whether the disc is 99% gone, there's a little tear in the back. I got to go zap that little guy with the laser. That's what takes the pain away. Doesn't matter how old the herniation is, or even whether you've had surgery on it before. I can still fix it.
Next question comes from Tino, once more on YouTube. They asked, would PT be recommended after DLDR?
So would PT, physical therapy, be recommended after the DLDR? Tino's question, absolutely. However, I generally like my patients doing their own PT. What that means is I will send them on a walking twice a day for 20 minutes for the first 2 weeks. 2 weeks after surgery, every day, morning and evening, twice a day, 20 minutes of walking with a full arm swing, okay, and comfortable shoes on a flat surface. Then after 2 weeks, I want them to gradually increase it to what's called a 15-minute mile. And that's where the patient does a full mile in 15 minutes or less. To do that, you really have to move your back, your body has to be swinging and moving. That's the best physical therapy they can do. Once they hit the 6-month mark, they can pretty much start doing normal activities, pretty much everything normal. Okay? Great question.
And last but not least, from Samir on YouTube, they ask, can you perform surgery for annular tears? I have an annular tear at L5-S1 and it is extremely painful.
Yes, Samir, you are right. Your annular tear at L5-S1 is the cause of your pain, and that is exactly what we're doing surgery for. I will go in with the laser and clean the tear. That will allow your annulus to heal, and it won't be in pain anymore. Every single one of these patients I've done for the last 16 years have exactly the same thing you do, an annular tear with inflammation. Well,
Okay.
I'm done.
No, you're done. Next two questions. This first one comes from Samir, once more on YouTube, and they ask, I have cracks all over my back after my back many times a day after the back pain started. Do you think it's related to facet joints or back pain?
So if I understand this question correctly, you have cracking in your back. That is always due to the facet joints. These joints right here, facet joints left and right, that's what cracks. That's why they call chiropractors back crackers, because they actually make the facet joints pop. And that's usually because of injury to the facet joint, has a tear in the capsule, which allows the joint to move around too much. It becomes hypermobile and it starts to pop and crack because a little bone spurs in there.
And lastly, another question from Teak on YouTube, and they ask, if I have lumbar and thoracic DLDR, could I return to work within 3 months as a paramedic?
Hey Teak, if you had the lumbar and thoracic DLDR, could you return to work in 3 months as a paramedic? Yes, you can. Yes, you can. Now, I want to look at your MRI just to be 100% sure, but I expect you to be able to return to full duty at 3 months.
And that is it for questions.
I hope you enjoyed the surgery. That's 3 down, 1 more to go. Our next one is a 3-level thoracic. She comes from Pennsylvania. She's had thoracic pain. All the doctors blew her off. Nobody could find a problem. They got MRIs of her thoracic. It was always read as normal, normal, normal. Poor woman has been absolutely suffering in debilitated pain. The shocking thing is her husband has stuck around at her side. You know, even though his wife has been complaining about pain for years in her thoracic, all the doctors telling her there's nothing wrong with your spine. Can you imagine the personal hell she's gone through? I can't. It's sad. I feel so much for these people. You know, just getting kicked around by the system, misdiagnosing them. We're going to go in and fix 3 discs. I think it's number 6, 7, like 8, 9, 9, 10. Anyway, we'll have that answer for you shortly. We're going to place 3 needles, 1, 2, 3. And she's amazing because she's like, here's my pain, here's my pain, here's my pain. I literally put in like 4 X's on her back right where her pain is, and that lines up with these herniations. So I believe her. I think she's going to get great relief. We have a 99% elimination of thoracic pain on our Deuk laser disc repair patients at 1 year follow-up, 13-month follow-up. That's pretty darn good. Nobody else comes close. Have a great day. We'll be back in 30 minutes or in 45 minutes for the